After you've woken up following the operation, you're in the recovery ward, and from the recovery ward you go up to the main surgical ward, which is on level 1 of the hospital. Up there you'll have pain relief. Most people can actually get by with tablets, and there's an advantage with tablets over intravenous painkillers because the tablets cause less nausea and the tablets last longer.
Once you go up to the ward, you will experience some pain. It will be controlled pain. We control your pain very well, but you will have some pain. And it's important for that control to be effective for you to take your regular medications that are charted and prescribed by your anaesthetist. That will involve regular paracetamol, a regular non-steroidal anti-inflammatory, that's a big word, but drugs like Voltaren, we prescribe those, and also some of what we call the narcotic drugs. Now these are very strong medications, but they're very appropriate for the sort of pain that you'll be having in the first 24, 48 hours, and even when you go home you may still need these drugs. And if they're used as prescribed, they're very safe. We just ask that you follow the prescription of your anaesthetist, and if you have any questions about these drugs, you must ask your anaesthetist. And most of the time you can call them directly, or you can call the prime anaesthetist through our rooms, which are easily accessible during business hours.
The people who have more discomfort will often need to have what's called a PCA machine, or patient-controlled analgesia machine. This gives them a button that they press every time they want a dose of painkiller. This works very well. However, at night when they fall asleep, they may not get quite as much pain relief as they'd like. So usually the next morning we like to get rid of the intravenous painkillers and put pretty much everybody on tablets. That allows them to get out of bed and allows them to get walking. When you wake up from the surgery, you're allowed to have something to drink. We are quite keen on you having a little bit of water to sip and some ice to suck, just to get you ready and keep you comfortable. The following day is when the work begins. So day 1 after surgery, we want to get you moving and we want to get you drinking. It's really important that we have you safe for discharge when you finally go home. And we don't consider people safe until they're drinking over 1 litre in 24 hours and until they're able to do a few laps of the ward. Because we don't want people to go home and then have to be readmitted. That's a really unpleasant thing for people.